Hi, everyone. I'm Professor Jane Heffernan, and I'm from the Center for Disease Modeling in the Math and Stats Department at York University. And specifically, I lead the Modeling Infection and Immunity Lab at York. And during COVID, I've been involved in the Mathematical Modeling Task Force for COVID at the Fields Institute, as well as some other initiatives and some other groups in Canada, and different collaborative groups globally looking at COVID-19. And so I'm going to talk a little bit about what goes on behind the numbers when we're looking at immunity, and particularly when we're looking at immunity and how it's distributed by age, given infection and given vaccination, and then how that distribution of immunity in a population can affect the fall resurgence that we're all talking about right now for fall 2021. Okay, so I'm a disease modeler, and I look at questions that focus on immunity. And so I look at how diseases spread at the population level. But we all know that a population is made up of many, many individuals. And so really what we also need to look at is how immunity affects or is acquired in an individual. And so that really has to do with your immune system. So I look at antibodies and T cells, and I model those and how they interact with pathogens and how they interact with, or how the vaccine can induce immunity in the body, so bringing up the antibody level and generating these memory cells that are going to give us long-lived immunity. But all of this relates to like how immunity is generated in an individual is related to their immune system status, and that can change over your lifetime. It's very different from different ages as well, how your immune system works. And so what we look at is how the individual immune system determines their susceptibility. So we can look at how we have lots of individuals in a population, and all these individuals have a different level of immunity. And so we quantify what that level of immunity looks like in terms of susceptibility. And then if an individual is, say, 80% susceptible, then they have a probability of being infected with the disease, but then their immune system can, the level of immunity that they have in their body at the time that they are exposed and get infected, then determines how severe their symptoms will be. And the severity of the symptoms and can give us an idea of who's going to be a reported case for COVID, who might not be a COVID case for COVID. And then when we also look at the viral load inside the body, then we can determine how transmissible someone will be. So then that then translates from the individual back into the population through transmissibility. So everything is determined by the initial condition of this person's immune system at the time that they're exposed to the disease. And so then what you have is lots of people who are going around in the population and meeting each other and hopefully practicing social distancing and mask wearing so that we can decrease the probability of infection, which is related to transmissibility and susceptibility. Okay, so I look at how the pathogen and the immune system interact. I also look at how symptoms can manifest in an individual. I use mathematics to quantify the level of or the severity of symptoms, which gives us an idea of reporting of a specific disease. I also model how the vaccine can activate the immune response, and I do that looking at different types of vaccines like AstraZeneca versus Moderna and Pfizer, for example. And then when I'm looking at a lot of individuals in a population, I'll also be modeling their behavior. So how well are they adhering to the rules and the guidelines for public health? And are they relaxing their mask wearing and their social distancing, and how that is all related to the current public health mitigation components in the population. And then for some diseases, what I also look at is how immune systems move around the world. So some people look at how diseases move around the world. I'm really interested in looking at the distribution of immunity and specifically looking at how when individuals move into a population or out of the population, how immunity in Toronto, for example, is going to change with travel and then during the pandemic, I've really been looking a lot at how we need to uptake social distancing practices, or you can call this physical distancing, and looking at mask wearing, but in different settings. So in hospitals, but as well as in looking at mask wearing in populations. Okay. So I said before that I'm really interested in looking at transmissibility and susceptibility, anything related to immunity. So that means that I look at in-host modeling, where I model the antibodies and the immune memory cells in the body. And I look at how these things can protect individuals from infection or severe infection later on. And then even later on, how immunity generated from infection or vaccination can be protective and give you a protection against a severe infection or infection entirely. But one of the things that we know about coronaviruses is that the immunity can wane over time. So your protection, while it can be high at a certain point, then it can decay over time. And that decay can be related to the mutations in the virus that's circulating. So mutations can be acquired in the virus, and then the virus can become more fit, which means it's more transmissible. And we've experienced that from the historical strain to now the Delta strain. We know that Delta has a higher probability of transmission. But also this decay of immunity can just be related to the fact that antibodies can naturally decay in a person's body over time. And so that means that the protection against infection is going to reduce over time as well. But we then also look at these T cells, these memory cells in the body, which protect against severe disease. And these cells can stay in very high quantities over long periods of time. But there's also a probability that in some individuals where their immune response isn't the greatest, maybe in some people who are older or people who are immunocompromised, the memory T cell population can also decay over time. And so what we do is we look at how this memory can be acquired by vaccination and then wane over time, maybe get a booster vaccination, or if individual gets infected and then maybe some immunity wanes over time and then they get a booster vaccine, or maybe they get another mild and apparent infection later on, which boosts their immunity. So what we do is we really use mathematics to track how immunity decays and is boosted over different experiences of the individual over time. So then, of course, we have to take into consideration if the individual is wearing masks, then they're going to be less susceptible, and if they're infected, less transmissible, and the same with social distancing. Okay, so here is an example of a model that we have developed to look at COVID-19, and this looks very complicated. But this is just to give you an idea of some of the things that we look at. So S means susceptible, V means vaccinated with 1 dose or with 2 doses of a vaccine. I means infected and transmissible, whereas E means infected but not transmissible yet. And what we do is we split the population up into different age groups. And then when individuals are infected from one of these susceptible classes, where we increase in immunity over these susceptible classes, so going from fully susceptible to fully protected. What we do is we determine if an individual in one of these susceptible classes is infected, if they'll have a mild infection, which is asymptomatic, if they have a moderate infection where they may have some symptoms, and if they have a severe infection, where a severe infection means that they'll definitely go to the doctor and some fraction of these individuals will go to hospital. So we use information about a severity of infection by age and probability of severity of infection by age from statistics and looking at comorbidities in different age groups to determine determine how many people will go to the mild, moderate, and severe infections. And then we assume that here, if we have a severe infection, these individuals will definitely be reported. A moderate infection, some people, if they feel a little bit sick, or if they have some symptoms, they may go get tested, so they'll be reported. But we can also have contact tracing, trace these individuals. And then we have these individuals down here who have a mild infection, which means for us, for COVID-19, that's asymptomatic. So we assume that these individuals aren't reported except through contact tracing, or maybe perhaps if they're going to go see grandma or grandpa and they need to have a test before they go visit to just ensure that they're not going to transmit the virus to someone who's elderly. So what we do is we take a model that looks like this. We model many different age groups, and we track the infection over time. We also track the vaccination uptake in all of these different age groups over time, and how that is related to all the different stages of the vaccination program. And then we use our model to quantify some distribution of immunity over time in the population in all of the different age groups. And so at a particular point in time, you'll think that, okay, well, if we're looking at individuals who are 10 years old, some of those individuals will be in this high protected immune class because maybe they had an infection, or maybe they were in this class and they waned down to this class, or maybe they had a moderate infection. But individuals who are 10 years old, who maybe had infection, are probably most likely to be here in this class here because they probably had a mild asymptomatic infection. But if we're looking at individuals who are 60 years old, then a lot of those individuals have had the vaccine. And so if we're looking at a particular point in time, say maybe a couple of weeks ago, a lot of those individuals will be in this high protected class because they've been vaccinated and with their second dose very recently. Some might be in this class depending on their immune response and how their immunity might have waned from the vaccination in a little bit of time, depending on their immune system status. We may have individuals down here as well, maybe from infection or maybe from waning, and so on. And so we're looking at all these different susceptibility classes, where these vaccinated classes are wrapped into these susceptibility classes as well, to look at protection from infection and protection against severe disease. So when we take this model and we model infection and vaccination uptake over time, we can then get an idea of what the distribution of immunity looks like in the entire population by age. And so here's an example of an outcome that we'll have from our model. So if we take all of these green bars here, these are the different age classes from 0 to 9, 10 to 19, 20 to 29, 30 to 39, 40 to 49, and so on, going up. Well, actually, it's even less. So here our age groups are, here's our 70 plus, here's our 60 to 69, 50 to 59, 40 to 49, 30 to 39, and then down here into the younger age groups. These are individuals that are fully protected against infection. So if they're exposed to the pathogen, in this example here for a mathematical model, if they are exposed, then they will not be infected. And you can see that there's a very small proportion of individuals in the younger age groups that are here. And that's because they haven't been vaccinated, because they're not, they can't be vaccinated, the 0 to 9-year-olds, as well as if they have been infected, they have a very high probability of having a mild infection, which means that they don't get full protection from infection when they recover. So they'll be in a lower level of immunity. Then here we look at the individuals that are in that S3 class or have had one dose from the S2 class. And you can see again, there aren't very many young children in this class. And there actually aren't very many people at all in this class, because either people move from this class to go get a second dose, or their immunity can wane back down the line to the S2 and the S1 classes. Here are individuals that have some level of immunity. And here you can see that we have a lot more children that reside in this group here, and so on. So this gives you an idea of what the distribution of immunity is going to look like over time. So everyone in the beginning of the pandemic had no immunity to COVID-19. So everyone was entirely susceptible. And so we have, here are 0 to 9-year-olds, 10 to 19, and so on all the way up. And then as waves of the infection come through the population, you start to get some infection. And the infection waves are represented by this white space at the very top. So where there are no colors, those are our infections. So over time, you can see that immunity starts to accumulate in the older age groups. So the darker blue and the darker yellow and the darker green. And that's from infection early on. So it's very hard to see, but it's there. And then later on from vaccination. So you can see as vaccination rates for 1 dose and 2 dose increase, then we're bringing up that level of immunity in the population. So this DOSH-DAT bar looks at current day. And so this is an estimate using this mathematical model of what the distribution of immunity looks like today on August 30th in the population. And you can see that we have quite a lot of people. So about 30% of people have this full protection in green, so they won't be infected if they're exposed. And then this yellow region here, those are individuals that have a higher level of protection and from severe disease and a little bit of a susceptibility to COVID-19. And then here we have some protection against severe disease, and we have some protection against COVID-19. And then we have these individuals up here that have 100% susceptibility to COVID-19 in the model. And so you can see that we have quite a few children from 0 to 9, and then 10 to 19, and so on. Now, this is just one outcome from our model. So we vary some of our parameters of our model, kind of looking at a sensitivity analysis, and then we look at what this distribution looks like at this particular date, because this distribution determines what the fall resurgence will look like in all of the different age groups starting in September. So here we can see that we get a pretty significant resurgence using this example. And what we find when we look at this resurgence, so here are our infecteds, that the individuals that will be most affected by the fall resurgence are going to be individuals who have had 2 doses of vaccine and have had their immunity wane. And so we see that around 50% of this resurgence here is in populations aged 50 plus. And so we have used outcomes like this in our model to suggest that booster doses in specific age groups will be important in fall resurgence. We've also looked at what this means in terms of looking at the immunity in children and what back to school protocols might look like. And so something that we find is that the magnitude of the fall resurgence doesn't vary much between a schools opened and a schools closed scenario. So that's an interesting result. And that's mainly because we opened up, we started relaxing our behaviors and opening up or relaxing public health mitigation early in the summer when the Delta variant was in circulation. And so when we started to do that, that meant that definitely we're going to have a fall resurgence. Interestingly, it also shows that given that we're definitely having a fall resurgence, having schools open and schools closed doesn't have that much of an effect. However, we do see that there's an important effect in that fall resurgence if people relax entirely and are not wearing masks and are not practicing social distancing, and that also includes schools. And so we suggest in our modeling that back to school protocols should include social distancing and mask wearing in elementary schools and in high schools so that we can maintain lower levels of infection so that we don't overwhelm the healthcare system. There we have that fall resurgence, and this is mainly because we started relaxing our behaviors back in the end of June and middle of July. And so the fall resurgence is guaranteed to happen. The magnitude of the fall resurgence really depends on social distancing and mask wearing, but also ultimately depends on people going to get the vaccine so that we can increase this distribution of immunity. Essentially, what we want a lot more people to be in this green distribution here, somewhat in the yellow. We want to shift people from the red and the blue down into these levels so that these have a higher magnitude, so that we have a higher level of protection in the population, so that the magnitude of the fall resurgence is a lot lower, so that we don't overwhelm our healthcare system. So the work that I have been showing you today has been done in a large collaboration with individuals listed on this slide, and as being funded and supported by all of these different funding bodies and other groups listed on the slide as well. It's been hosted by my Modeling Infection and Immunity Lab that's at the Center for Disease Modeling at York University. I thank you for your time, and I hope that you are able to understand some of the things behind the numbers that you're all hearing about the fall resurgence from this presentation. Thank you very much.